Hello everyone, my name's Carl and I'm a trainee health psychologist. I'm currently studying the Stage 2 doctorate at Stafford University and I'm also a graduate of the Health Psychology Masters at UCLAN. Now the aim of this video is to demonstrate a method to help ensure that your health promotion videos which you're going to create are evidence-based and theory-driven. And by the end of the video, you will be able to explain the 3 levels of the Behaviour Change Wheel framework. You'll be able to outline the 3 components of the COM-B model, and you'll also be able to demonstrate knowledge of how to apply the Behaviour Change Wheel framework to the design of health promotion videos. As you may know, interventions that are underpinned by theoretically driven behaviour change models are more likely to be successful and to lead to longer lasting changes. And although it goes without saying, and you've probably been learning this since the first day you started the Masters, it's key that you try to underpin your health promotion videos with evidence-based theory. And when it comes to changing behaviour, there are so many different theoretical approaches that you can take, with the most common being the health belief model, the theory of planned behaviour, trans-theoretical model, also known as the stages of change model, and these are the main ones that you would have come across already. There's also other models that are more specific to communicating health messages, which tried to influence behaviour on more of a mass media scale. These include the communication persuasion model and the social marketing theory, which is then applied to healthcare. I do recommend that you go and source them models out and read around them and see if there's anything that you can take from them models and apply to your health promotion video that you're creating. In addition to the behaviour change theories and models, there's also a number of evidence-based frameworks that help designers develop and evaluate health interventions. Now, the ones that you might have come across so far are the Intervention Mapping Framework and also the Medical Research Council's Complex Interventions Framework. Because a large number of models have been developed to explain changes in behaviour, decide on the most effective one or number of models or aspects of models has proven to be really problematic, and you might have already experienced this in your time on the course. And because of this, in around 2014, Michi and her colleagues developed a more simplified behaviour change model that also was directly attached to a larger framework. And the model was called the COM-B model, and the framework was called the Behaviour Change Wheel. And the way they made this was that they took 19 of the most effective frameworks, which what they believed didn't work in isolation or only worked for certain aspects of behaviour change in isolation. They were integrated into one holistic framework, making it highly applicable to any behaviour setting, whether that's at the individual, group or population level. And because the COM-B and Behaviour Change Wheel incorporate many aspects of other frameworks, I thought that it would be good if we use them to explore how we can apply that to designing health promotion video content. The initials COM-B stand for capability, opportunity, motivation and behaviour. And the main premise of the model is that for any behaviour to happen, the individual, group or population must have the capability, opportunity and motivation to perform it. So for example, to eat healthily, which is a behaviour, a person must know what healthy food is. So that's having the capability to know what healthy food is. They must also have the motivation to eat healthy food, which could be understanding the pros and cons and what it means to them. And they must also have the opportunity to eat healthy food. And that could be having the money to buy it or having a kitchen to prepare the food, things like that. So just to go a little bit deeper with the COM-B model, each of the 3 components also have 2 subdomains. So for example, capability consists of physical and psychological capability. And this could be the physical skill to perform something. So let's take healthy eating again. So someone might be able to have the skill to actually use kitchen equipment, knives to prepare food. But they will also have to have the psychological capability. So they need to have the understanding around what healthy food actually is. With opportunity, there is a physical and social subdomains. Physical opportunity, in terms of eating healthy, would be to have the physical facilities to be able to make the food. And you will also have to have the physical finances to be able to then go and buy the food. In terms of social aspects of opportunity, that'll be factors including their social norms, the cultural norms that they live in. Is it accepted to eat fruit and veg, or are you're gonna get laughed at for doing that, for performing that behaviour? Motivation has reflective motivation and automatic motivation. And now you can think of reflective motivation is in terms of what the individual believes about healthy food, for example. Do they believe that eating healthy is going to benefit them? Are they going to set certain goals that are going to keep them motivated to keep progressing forward and to carry on eating healthy food? Automatic motivation relates to factors such as wants and needs and impulses and reflexes and habits that people have. The COM-B model sits at the centre of the Behaviour Change Wheel. Now, the Behaviour Change Wheel is made up of intervention functions and policy categories. There's 9 intervention functions and there's also 7 categories for policies. Now, these 3 things together, these create a integrated framework that can help us to design a very comprehensive and evidence-based interventions, and that's whether that's at the individual, group or population level. So this can be used for other interventions in the future, not just for health promotion videos. Also, for each intervention function, there are many different techniques that can be used to effectively bring about behaviour change. And these are actually called behaviour change techniques. And we'll come back to them a little bit and look at them in more detail later. Overall, you can think of the COM-B model as the tool to identify what needs to change. And then the behaviour change wheel, you can see that as the tool to identify the best way of going about delivering that intervention. So in the book, Behaviour Change Wheel, A Guide to Design Interventions by Susan Michie and colleagues, they set out a 3-stage process to design interventions. We're going to look at this process and apply it to developing evidence-based health promotion videos. There's 3 stages. The first stage is understanding the behaviour. The second stage is identifying intervention options. And the third stage is identifying the content and implementation options. And as you can see, each stage has its own number of sub-steps that need to be taken. This first stage is all about doing the groundwork to try and understand the problem and to find out exactly what needs to be addressed. Now, the first thing we need to do, according to Susan Michie and colleagues, is to define the problem in behavioural terms. Now, what they mean by that is, instead of saying cardiovascular disease is the problem, we would say that eating unhealthy food is the problem, or being sedentary is the problem. And the reason why is because cardiovascular disease is the condition, not the problem. It's the behaviours that result in cardiovascular disease which are the problem. So that would be eating unhealthy food, being inactive, poor quality sleep, drinking too much alcohol or sugary drinks. Those type of things, they're the behavioural problems. So when you're doing your research, you'll be trying to find out what are the behavioural problems causing this condition that we're trying to target. And once you've done that, and you've got a list of these different behavioural problems, they can then decide on which one you want to target your intervention on. So once you've made your list of all the different behaviours that could relate to the problem, and you've chosen which of those main behaviours you want to focus your intervention on, the next step is to identify all the specific behaviours that are required or associated to that main target behaviour. For example, for someone to eat healthy, they don't just do the act of eating food. There's a lot of other factors that are involved with it, and we'll look at that in a little bit more detail in a moment. Now, it's important to get an understanding of all these different associated behaviours, because behaviours work as part of a larger system, and they don't just work isolated or within a vacuum. And by understanding all the associated behaviours to the main behaviour, we can start to get an understanding of which of those associated behaviours have the biggest impact on the desired outcome of eating healthy in this case. So let's put a little bit of colour onto this and let's look at an example. So we'll use healthy eating as the example target behaviour. For healthy eating to occur, there's a number of other behaviours that are also related to achieve that outcome. And this could be either within the individual themselves or people in their environment, or it could be other factors in their environment that could affect whether or not they eat healthy food. Within the individual, you've got to think about the behaviour of them actually buying heart healthy food and avoiding unhealthy food, and also cooking their food. To eat healthy food, they need to be able to cook healthy food, and also to buy healthy food at work as well. Now, for them to be able to do that, there might be other factors that influence it. Like, for example, there might be somebody in their household who does the shopping or who does the cooking, and then that requires that person to buy healthy food and to cook healthy food. And then you've also got the other environments that they're in. So it could be at work. They might not make lunch at home, so they might go and have lunch at work, and the canteen at work might only sell unhealthy food, which affects the individual eating healthy food. So the authors of the book, they advise at this stage you make a list of all the associated behaviours that are required for the target behaviour to occur. And by doing so, it should be easier to identify which behaviours have the largest impact on the desired outcome. The next step is to choose which of those behaviours you're going to focus on. And Michi et al., they suggest that it's best to focus on one or two behaviours, and that you should follow the less is more rule. For the purpose of this example, we'll use the behaviour of buying heart healthy food, as this action precedes the act of actually eating healthy food. So now that we've decided on the target behaviour, the next step is to specify the behaviour in appropriate detail and try to put the behaviour in its context. I think what the authors are trying to get us to do here is to be really precise about the behaviour and try to be really clear on what it is that we're trying to change. And they recommend that we try to specify the behaviour by asking ourselves 6 different questions. So the first question is, who needs to perform the behaviour? So for our example, this is people at risk of cardiovascular disease. The second question is, what does a person need to do differently to achieve the desired outcome? Now again, in this instance, it's likely that the person needs to buy less food that contains unhealthy ingredients, such as hydrogenated fat and high refined sugar content, and they need to buy more fresh produce. The third question is, when will they do it? Now for us, it's going to be when buying food at the shop or at the restaurant or at work. The fourth question is, where will they do it? So it's places where food is sold, wherever they're going to be purchasing food or where they're going to be offered food. The fifth question is, how often will they do it? Now, hopefully, it's going to be as much as possible. That's what we're going to aim to do. And the final question is, with who will they do this behaviour? And the answer to that is either by themselves or with anybody else. So once you've specified the target behaviour that you're trying to change, which in our case is buying healthy food, the next step is to identify the things that need to change for that behaviour to be performed. And this includes identifying what needs to change either in the person and or in their environment. And this is where the COM-B model comes in. Because what we're going to have to perform is a COM-B analysis of the target behaviour. And to do this, we need to gather all the information that we've collected, either through the literature reviews that we've done or from the research, whether that's through doing interviews or focus groups or through doing quantitative surveys. And we take that information and we look at all the different barriers that are affecting people with cardiovascular disease from eating healthy. And then we map all those barriers, all those factors onto the 6 subdomains of the COM-B model. Through the research that I've performed, these are the barriers that I've identified and have mapped onto the subdomains of the COM-B model. So as you can see, if we look at psychological capability, which is the first section in the top left of the table, we can see that one of the barriers of people buying healthy food is that they're not aware of what foods actually promote a healthy heart. Also, the lack awareness of the implications of eating food that might cause inflammation or atherosclerosis within the actual arteries, the buildup of the fatty deposits. Also, as well, they might lack the psychological capability to be resilient when making these changes. So there's many different factors that you can map onto these different areas. And the more research you do and the more factors that you get on there, then the more reliable the analysis will be. Now we've got an understanding of what needs to change for the desired behaviour to be performed through doing our COM-B analysis and identifying all those different barriers. The next stage is to establish how we're going to reduce or remove them barriers so that the behaviour of buying healthy food can be performed. So to do this, we're going to move on to the 2 outer rings of the Behaviour Change Wheel, the intervention functions and policy options. So we'll start with the intervention functions and try and find out which of those are going to serve our intervention best. So there's 9 intervention functions that link directly onto the COM-B model, as we'll see shortly. So each intervention function has got a definition and also an example. And if you go into the Behaviour Change Wheel book that I've shown before, then all the definitions and examples of how to use these different functions are in there. But let's get a bit of a flavour for it by looking at 3 of them. With education, the definition is to increase knowledge or understanding, and you can do that through providing information around healthy eating. Persuasion is about using communication to induce positive or negative feelings or stimulate some kind of action. An example of this is to use imagery. It might be posters of somebody famous who's in good shape, or it could be pictures of themselves on the fridge, which then might motivate someone to exercise. And modelling is providing an example for people to aspire to or to imitate. And again, using people of key influence to demonstrate the joys of cooking is an example, and eating food. And that might be somebody who, it could be a fellow sufferer of cardiovascular disease that is showing that they can make the changes. And if they can, then the people who we're directing the videos at, they can too. To get an understanding of what intervention functions are available to us, we can use what's called the intervention functions matrix, which is basically a tool to help us work out which of the functions are relevant for each component of the COM-B model and the corresponding identified barriers. Now, this sounds a little bit complicated with me just talking about it. So let's look at an example. So we look at psychological capability. We can see that there's an issue with people at risk of cardiovascular disease not really understanding what healthy foods are to promote a healthy heart. So according to the intervention functions matrix tool, we could approach that problem by either educating them, through training them, or through enabling them to be able to understand what healthy food actually is. So this stage is basically going through all the identified factors and using the matrix tool to find out which intervention functions are most appropriate. So once you've done that process, this is what the outcome might look like. So you've got a list of all your identified barriers, and you've also got a list of all the intervention functions that will likely bring about change or might reduce or remove those barriers and help people buy, in this case, healthy food. The next key step in this intervention design process is to identify which policy options are going to support the delivery of the intervention. Now, this is specifically important for the video project that you're going to be creating because of the mode of delivery. Because a video project and a video health promotion message is digital communication to a mass audience, it restricts the type of intervention functions that you can use. So to help us understand which functions are available to us through mass media, we can use what's called the policy matrix tool. So if we look at the policy matrix tool, we can see that for communication marketing, factors such as training, restriction, environmental reconditioning, and enablement, those factors are not available to us. So this actually helps to whittle down what we're going to focus on for the intervention, because all the barriers that we identified in our COM-B analysis that require those modes of delivery, we can get rid of them. So as you can see, all the barriers that are highlighted in red and all the intervention functions that are highlighted in red are the ones that we're not going to focus on because we're not able to impact those barriers through a mass media video promotion campaign. And as you can see, that whittles down the barriers that we can focus on and the type of intervention functions that we can use. So now we're going to move on to the third and final stage, which is to identify the content for the intervention. So to do this, we need to first identify and then choose which behaviour change techniques are going to be most effective at minimising or removing the barriers to performing the desired behaviour. So in this case, for this example, we're trying to look for the most relevant behaviour change techniques that are going to remove or reduce the barriers to people buying healthy food that's going to promote a healthy heart. A behaviour change technique is defined as an active component of an intervention designed to change behaviour. And there's absolutely loads of these behaviour change techniques if you didn't know already. And if you go to the Behaviour Change Wheel book, you'll find a list of the most frequently used and least frequently used behaviour change techniques for each of the intervention functions. And this gives you a really good guide or a starting point to choose which behaviour change techniques are going to be most effective for your intervention. And as you can see now, the two examples I've got up just to give you just to provide a bit of colour is education and persuasion. So the most frequently used, or one of the most frequently used behaviour change techniques for education is information about health consequences or information about social or environmental consequences. And the least frequently used are things like behavioural experiments or biofeedback. Now, in terms of persuasion, one of the most frequently used behaviour change techniques is providing information or using a credible source, which then obviously the information that you provide is going to carry some weight, whether that's an influential person or a research study that's been peer reviewed, something like that. So I do recommend going to the book and getting familiar with these different types of behaviour change techniques, because I think it will really help with any other interventions you're going to create in the future. So for this process, what you're required to do is go through the list of all the different behaviour change techniques and decide which ones or which one you think is going to be best to bring about the desired change. And once you've done that, this is what it might look like. As you can see, going through this 3-stage process has left us with a list of different barriers that we can focus the intervention on. And it's also provided us with an understanding of the best ways to go about delivering the intervention. So now at this stage, all that's left really is for you to decide which of those barriers you're going to focus your intervention on. There might be some indication from prior research that you've conducted, whether it's from doing your COM-B analysis, where you found that a certain barrier has the biggest impact on the outcome that you're trying to achieve. So you might decide to focus all your intervention on one of those barriers. Or you could go the other way and decide that you're going to focus your intervention on all those barriers to achieve the desired outcome. And I think it just depends on what intervention you're actually thinking of creating and your means of being able to create the intervention, whether it's money, time, the team you've got around you, all these different factors. For this example, I've thought about the restrictions of the video in terms of that it's only going to be 3 to 5 minutes long. And I'm thinking, am I going to be able to address all these different issues within that time? And the conclusion I've come to is that I don't think that I will be able to, and that I'm probably best off actually focusing on some of those factors. So all those that are highlighted in red are the barriers and intervention functions and behaviour change techniques that I'm going to remove from this. And I'm going to focus on these specific barriers. You might have noticed that I've not gone on to the final step of the 3rd stage, which is to identify the mode of delivery. And the reason for that is because we already know what mode of delivery we're going to use at the start of this intervention, which is to use help emotion videos. If you're going to create interventions in the future where you don't know what mode of delivery you're going to actually use, you'll go on to that step, and that'll help you identify the best mode of delivery for the barriers that you've identified, for the intervention functions that you've identified, and the behaviour change techniques that you've identified. But for the purpose of this video, we're going to now move on to the final bit. Now that we've got the list in front of us of the barriers, intervention functions, and behaviour change techniques, what we can do, we can look at this from a different perspective that might help us to start putting together a skeleton narrative of a help emotion video. So for example, people at risk of cardiovascular disease, they're not buying healthy food as they don't know, or they don't seem to understand fully what healthy food is. So what I will do, I'll provide some information to demonstrate the difference between heart healthy food and heart clogging food. And I'll ensure that this information comes from a credible source, whether that's a research paper, health professional, another peer, or maybe Heartbeat staff. Also, people at risk of cardiovascular disease are not aware of the health consequences of buying and eating unhealthy food. So what I will do is provide some information on the health consequences of eating unhealthy food from credible sources again. Again, research papers, health professionals, peers, things like that. What else? So there's also people at risk of cardiovascular disease. are not fully aware of the susceptibility to developing the condition or experiencing a deadly cardiac event. So again, what I will do in the video, I'll provide some information or some education about the dietary factors that increase susceptibility to cardiovascular disease, which may then persuade or coerce them into changing their food purchasing and eating habits. And one final one, people at risk of cardiovascular disease require a demonstration of how to perform food purchasing behaviours. So again, what I will do is I'll provide them with some kind of demonstration of how to buy healthy food from various sources. It might be from the internet, it might be it might be a peer sat at a computer typing in different healthy foods on one of the big supermarkets websites to show them how you can do it and how people that are in the same position as they are can still perform these healthy behaviours. So now you've got to this point and you've gone through this process. You've created a theory-driven, evidence-based skeleton structure for which you can start to build your health promotion video on. And at this stage, your creative skills are required to start packing out that skeleton structure and creating some kind of storyboard narrative that's going to get these messages across. Throughout this video, we've used the COM-B model and the Behaviour Change Wheel to develop the structure of an evidence-based health promotion video. We've followed the 3 steps to designing an intervention set out by Michi et al., which started as a behavioural analysis of the problem, making a behavioural diagnosis of what needs to change. Then we link that diagnosis to intervention functions and behaviour change techniques to bring about that change. I hope that you found going through this process beneficial. And when you come to develop your health promotion video, this is a possible method to help you ensure that the messages are relevant and backed up by behaviour change evidence-based theory. But remember though, as Michi and colleagues point out, this behaviour change wheel process is not a magic bullet, but what it does do is provide a systematic and holistic method to recognising what needs to change and how best to go about it. Thank you for watching and good luck with your projects.